This viewer question's a little bit more complicated, but a good one. And I will do my best to keep this not too lengthy. But here's the question. How long until you can walk normally after a bone graft surgery? And the answer is behind the bone graft reason, if you will. And that's to fill a void. So there is either some bone that didn't live, or there were some crushed areas that you need to maintain length. But the bone grafts themselves do need to go through a process. So for example, if it's an autograft, that means from your own body, or even an allograft, which is from someone else's, these are cadaveric bone. These spacers, if you will, don't just show up inside the body and say, hey, I'm here, let's get the healing going. It actually phagocytizes or gets eaten up by the body, and the only thing left is this natural scaffolding. And the body says, hey, I recognize this, so I'm going to have my vessels come in and really start to incorporate into where the bone graft was. And then something forms called the osteoid, which is the living bone. And that is not the strongest bone, of course, because the second phase and final phase is the calcification. And then once that's all together, then the bone graft is solid. The stages are lengthy, meaning usually the bone graft is incorporated around 6 to 8 weeks, starts to calcify. I see the average date around 3 months, but according to some of the other videos that we were talking about with torque and our area of our specialty, the foot has a massive amount of force, torque from the entire body weight up here, pushing off. So if the bone graft is anywhere in the foot area, and sometimes even in the ankle, when we fuse the ankle or have to remove an ankle implant, put a little spacer in there, a bone graft, that too will come under the same amount of stress, no matter what kind of hardware you put in there. So it's a very lengthy process, and unfortunately, non-weight bearing is extremely important. This is not a no pain, no gain major physical therapy afterwards. You want to wait for this to totally incorporate. So again, the target dates are around 3 months, and then depending on the blood supply, patient age, health, all those factors, you could be looking at normal walking all the way up to about 6 months. What you're going to be like for the rest of your life, I candidly tell patients from the start of one of these surgeries all the way to 1 year, that's probably our time where, hey, it's not going to get any better than this. Again, hopefully that was helpful. If you have any other questions, you can log on to the Ask Dr. Moore channel or my other one, which is Dr. Robert J. Moore III, and post them there. And again, thank you for tuning in. Stay healthy and one step ahead.